Hello, my name's Elizabeth Aloof and I'm a third year medical student from Brighton and Sussex Medical School. And I actually didn't realise I wanted to go into medicine until quite late, like a month before I had to hand in my application, kind of late. And I've heard of a lot of people talk about how they've wanted to go into medicine from a very young age, but I didn't really know what I wanted to do. And I was doing my A-levels and I fell into the category of I was somebody who was good at science, who likes helping people and didn't really know what they wanted to do for the future. And there was a stall at my college that was about going into medicine, and it was a BSMS stall because I'm from Brighton and I've always lived here. And they talked about how a lot of people fit that kind of group of doing chemistry and biology and then wanting to go into medicine. And it's just something that I'd never considered personally because I don't have anybody in my family who's gone into medicine. So I went to an open day because I heard that that was coming up. And I just really liked the environment there and everybody just seemed really happy, and I spoke to a couple of the medical students there, and I think I'd kind of alienated becoming a doctor because I just never had experienced it myself, but everybody there just seemed like people that I could relate to, and everything that they talked about, what they loved about medicine, seemed like things that I would enjoy. I was also really overcome by the fact that they had 3D printers. So I remember my dad had taken out the newspaper article, how they can do 3D printed models about like the heart and the spine and whatnot. And for some reason, I just found that really cool. And that was actually one of the main selling points for me. And yeah, I just really liked it on the open day. And so that's why I decided to go into BSMS. So I went into medicine because I actually liked BSMS in the first place. And my best memory of medical school was in year 2, and we have something called symposiums, and that's basically where we have a schedule, usually about 3 hours, in which the first chunk of it is about the medical side of it, where we have a lecture, and then the second half of it is where a patient or a group of patients come in and they talk about their condition, and then we can ask them questions about it, like what their experience in the hospital was like and whatnot, so we can get a better holistic view of what the disease is like. And one time we had a leukemia symposium and we had 3 patients, and one of them was this little old lady, and when she was introducing herself she said that she was 90 years old and that she was actually just turned 90 today, and that she was officially, I think it was about 5 or 8 years free from leukemia. And the whole lecture theatre just started singing happy birthday out of the blue and started cheering and applauding and stuff like that. And I just remember this cute little old lady, and she was just crying, and she was saying that this is the best birthday that she's ever had and how she just loved being there. And it was just, I don't know why that stuck with me the most, but I just really remember that moment. I've met loads of leukemia patients since, but I really remember her. She was really nice. And regarding tips that I have about applying to medicine, being in medicine and all that kind of stuff, the 2 main tips I have, one of them is about choosing which medical school you want to go into. So when I was doing the application process, I was in this group of other people trying to apply into medicine, and they talked about when they were deciding where to go to, they had these figures and these numbers and these facts about which one's the best medical school to go to because of this graph or because of this, this and this. And I always felt like I couldn't justify why I wanted to go into BSMS at the beginning, like I just liked it. And I think at the end of the day, that's just true. And I remember speaking to a BSMS person about it, and they said that applying to medicine isn't quite the same as other places where the university you went to really makes a massive difference in your application process and it gives you a leg up or whatever. In medicine, you just need to be a doctor. All you need is a qualification. And in medical school, one thing that I've found is I don't think I've ever seen somebody fail a year because they weren't smart enough. I've seen people drop out because they couldn't deal with the mental health aspect of it. And the best thing you can do is just go to a medical school that you enjoy being at. And then once you've got your doctor degree, you can work anywhere. So it doesn't matter where you go to. The best thing you can do is just get the degree. And I think that really helped me. And I kind of felt like applying to medicine was kind of like buying a house. Yes, you need to do your research about it. You want to make sure about the area. You want to make sure it's, cost and all that stuff. But at the end of the day, do you like it? And if the answer is yes, then it seems like a good place to apply to. And for me, the answer was yes. I just enjoyed BSMS. And so I just went there. So yes, there's some figures that you should consider. Like, for example, BSMS has one of the best student satisfaction scores and also quite a low dropout rate. And that was a really big component for me. But at the end of the day, I didn't get too bogged down on statistics like everybody else did. I just liked it, so I applied there. And I'd recommend that you do the same in your application process. Another tip that I'd say is about mental health. As I said before, mental health is a very big component to why people drop out of medicine. So looking after your mental health is very important. And I know that I'm not the first person to make this groundbreaking point, but you really do need to be careful. I've seen so many people in open days where I've asked them, oh, so what hobbies do you do? And they're just like, oh, I don't, I'm just doing my A-levels. And the thing is, a lot of people do have to drop out of things because of exams and whatnot, but you can't just give up on all of your hopes and dreams other than academic wise. Like, you'll never meet a doctor who doesn't have a hobby, because you really do need it. And I know that in medical school, I really found the importance of having hobbies like baking, like sports. I don't think I know a single BSMS person who doesn't do a sport of some kind, because you do really need to look after yourself. So one thing I'd strongly recommend is, yes, work on your application, but when you've got the spare time, especially in the summer holidays right before medical school, if you get in, I definitely recommend finding hobbies that help you with your stress, because that's a very, very important tool when you actually get into medical school. Now, I've done a full article talking about this, so if you want to read it, you can click the link below, and then it'll take you to read the whole thing.